here now to talk more about the plan. Minister Holland, great pleasure to have you in studio. Thanks for making the time.
Thanks for having me, Vassy.
Did you do this, Minister, because it's the right thing to do or because it's politically expedient and allows the NDP to keep your party in power?
It's the right thing to do. Oral health is health. And when you take a look at, and unfortunately I've talked to so many folks working in emergency rooms or in medical circumstances where people haven't gotten the oral health care they need. And what that means is they have to wait until it's in crisis to go into an emergency room. Not only is that incredibly costly, but it's just devastating for that person's health. We also know that not having good oral health means possibly cardiovascular disease, diabetes, other chronic diseases and illness. And also it's just an issue. Having a healthy, happy, joyful smile is part of having dignity. When I talk to seniors, I was out in Nova Scotia and I had this opportunity, I talked about it today, to talk with a group of seniors. Say, well, this isn't really going to happen. I said, no, it is. And they said, well, I've had dentures for over 20 years that I've been having. I can't get them replaced. I don't have the money. When they realized that they were actually going to be able to get new dentures, what that did for their dignity, the joy that I saw in them, one of the most powerful moments I've ever had in my political life, to see how transformative this is for people, for their health.
If you are so convinced of the value of it, why did your party, for example, vote against an NDP motion back in 2021 that essentially listed all of what you're doing now back then?
Well, one of the things as health minister that's really hard, Vassy, is that, I go across the country and I see solutions everywhere, but we can't do everything all at once. And as much as I wish we could, we need to make progress and do what we can, where we can to move forward. And this is the right time to move forward with dental care. And
is it the right time, though, with respect, Minister, because Jagmeet Singh forced you to say it was the right time in order to stay in power, or did you come to that realization?
No, look, I think that we've talked for a long time as well as a party about dental care. We talked a long time as a party about child care. And these are things that are not easy to bring into existence. They're incredibly difficult, but they're the right thing to do. And I really support the fact that the NDP has come forward in this parliament with solutions, saying, look, we're facing incredibly difficult times globally. There's nobody who's getting it easy these days anywhere on the planet. And it's easy just to hold the mirror up, as the Conservatives do, and talk what's wrong and criticize and denigrate and push down. But actually coming forward and putting up your hand and say, here's a solution. Here's a way that we can make things better. And I think on dental, it's so important because it's also prevention. I can't imagine, not only the social justice, how much money we are going to save as a result of people not having to wait till it's an emergency to go into to get their dental care. The prevention, the avoidance of cardiovascular disease, the avoidance of diabetes.
Is there an analysis of how much money that will save? Because we know how much it'll cost, $13 billion plus the cost afterward. Has your government figured out how much it will save? It's
a great question. And unfortunately, with prevention, we can't know the quantum of that until we do it. We do know it's going to save an enormous amount of money. But it's one of the things that's difficult around the realpolitik of prevention generally, because you can't actually know until you do it just how much money it's going to save. You know by avoidance that it's going to avoid all kinds of illness. And so we're going to be monitoring that so that we can report out to Canadians on what's the impact of this program, not just on uptake, not just on better oral health, but also on cost avoidance. And so that's baked into this, that evaluation to be able to demonstrate its worth.
You also talked about how the program itself isn't easy to lift. And it's in that vein I wanted to ask you about some of the particulars about the implementation, especially how Canadians who are tonight watching and think they will be able to access it, especially like the idea of actually having full access. And by that I mean, how do we know dentists are going to sign up? There was nothing in the announcement I heard today that compels them to do so.
Well, we've been having really positive conversations with providers. And it's important to note that oral health professionals, whether they're hygienists or dentists or denturists or whoever they might be, they've been advocating for this forever. They want to see every Canadian have access to oral health care. And so the conversations that I've been having with them are just asking that they be treated justly in this process. But they share in their heart the same intention and have been advocating for this for a very long time. So they're excited. But there's other details that we have to work out to make sure that we get all the providers lined up, and we're continuing to do that. The first folks who are going to be receiving services are going to be in May of next year. And the conversations that we've had with providers have been incredibly constructive. And as I say, they themselves have been advocating for this.
I see that the Canada's Provincial and Territorial Dental Association is flagging that there was limited involvement of practicing dentists. You're saying tonight that you have assurances, that there's reason to hope, but what concrete things can you tell Canadians about the accessibility of this program? Do you know for sure that there will be enough dentists ultimately who participate to service 9 million people who you say are eligible?
Well, first of all, let's acknowledge 9 million people is a lot of people. And these are people who have no coverage right now. And that we are going to be rolling this out in cohorts so that at each opportunity we can sort of ease into the adoption of this program. And it's not going to happen overnight. And that there are barriers, frankly, that aren't even just, I have coverage. There are, for people in rural, remote communities, persons with disabilities, additional barriers and challenges. So we have this oral health access fund to tackle that. And the engagement that we've had, and of course, the oral health profession is enormous. We've had a huge amount of engagement over the last year. It doesn't mean everybody, because there are so many professionals there and there's so much more engagement that has to be done. But I've been having fantastic conversations with oral health providers, including as of this weekend, about how we're going to work together. And they have been incredibly positive and constructive, and I'm very confident in delivering
What's
this program.
the incentive, though, beyond the goodwill? Is there, have you set a fee schedule that you can assure providers watching tonight is commensurate with what they would have through private insurance companies? Will you look at potentially seeing those fees increase in order to incentivize them? Again, 9 million people. I know it's phased in, but it's a lot of people.
Sure it is. Sure it is. And we can't allow perfection to be the enemy of progress. These are people who have no coverage. And one of the things
asking to make sure that they have access is not asking for perfection. It's just to make sure there's enough dentists signed up.
And for sure. And that's at the heart of our objective. The providers have to be happy. They have to be excited. And I can tell you the reason why I know we're going to get this done is because providers have in their heart, and this is, I can't believe the conversations I've had. They've been so positive. Providers want to be able to ensure everybody gets oral health care. They have been advocating for this kind of action forever. They just want to make sure what we do is fair and just. And the conversations that we've been having have been really framed on that basis and have been incredibly constructive and positive. And so, how do I know they're going to do it? Because they've been advocating for a decade and a half, clearly, loudly, publicly, that it needs to be done. And all they've asked in return is to be treated fairly in the process, and that's 100% what we're going to do.
So can I infer from that you will, that the federal government will ensure that the fees that they can avail themselves through this program will be at the bare minimum commensurate with what they would have elsewhere?
Well, what you can say is that that when we engage in fees for providers, that the conversations we've been having are respecting them as professionals and respecting that they deserve to be fairly treated and compensated, and that is the core of what we're doing. And
does that mean it's the same publicly as it will be privately?
Well, and yet I'm sure you understand this, Vassy. Today it's about launching kind of the overall details. In February, we're going to be actually outlining exactly what that means in terms of the providers. So at each stage, just like I couldn't talk more about the things that I'm now able to talk about today, we're going to release more details. So in February, we're going to be able to go a lot deeper, and hopefully I can come back on your show and we can get right into those details of what does this mean for the providers. But today
I certainly understand I'm not asking for the exact price per schedule, but in a general sense, is that fair? Is that a fair thing that those providers watching tonight who do want to participate can infer from your comments?
I think what they can infer from the comments is that 100% we're going to ensure they're treated fairly.
And what's to stop, final question before I let you go, I know your time is limited, what's to stop a private employer from deciding that those people who now qualify for this public insurance program should avail themselves of that, and they no longer have to make the investments they are on their end? Is there anything in the plan that you're announcing that would prevent that from happening? Sure.
We're looking at things that we can do specifically, but I would say more broadly that insurance typically covers a lot more than just dentistry. It covers a broad range of things. This is not intended to be, a windfall for employers to shirk their responsibility to employees. This is an opportunity for those that don't have coverage to be able to get coverage, and so we're having having conversations with industry, with provinces and territories on how we work together, not to steal from this moment an opportunity for profit, but recognize this is fundamentally about people's health. And if we're going to get to the kind of healthcare system that we need, then we all have to work together, not to put our interests first, but to put the interests of Canadians first and their health. And we saw this light in the pandemic, this moment where the entire health system was asking one question. The whole country was asking one question. How do we protect people's health? How do we work together? How do we set aside ego and jurisdiction and partisanship and drive the change that needs to happen? That's what Canadians are demanding right now in their health system. And I think any company, any province, any territory that doesn't meet this moment with that spirit, it's not going to be met well.
But what does that mean? I take all those words at face value, but does that mean there will be a legal impediment, for example, that you're going to set up in conjunction with provinces to make sure that companies don't do that? Because with all due respect, if my motive is, profit and making money for my shareholders, and I can reduce my costs because there is a public program that does the exact same thing, why wouldn't I avail myself of that?
And we're working on additional mechanisms. But and again, as we move out towards February, we're talking about providers, and well before May, before anybody gets service, we'll be in a position to talk in more detail about some of those things. But I think today it's an opportunity really for us all to reflect on the type of society that we want to have and how we're comporting ourselves, particularly in the realm of health. And I have to say that when I was in Charlottetown talking with my provincial and territorial counterparts, that conversation was really focused on how we work together, how we set aside our jurisdictional differences, our partisanship differences. We had a great announcement out in BC.
There's a lot of jurisdictional stuff that still happens despite those intentions.
Sure. Look, I think, Vassy, you can only change the world one step at a time. You can only make a difference one collaboration at a time. And it isn't easy. What I'm talking about, it isn't easy, but if you're going to change the world, you have to put out as an intention where you want it to go. And then you have to ask that everybody use that logic to interrogate and question the actions of people. And so our actions are going to be entirely focused on the best health of Canadians and on logical ways of doing that. And you can interrogate me against that any day of the week. And we should all interrogate every business, every province, every territory on the same basis.
Okay, Minister, I have to leave it there. I'm out of time. I appreciate your time as always. Thank you.